All right, what's up, guys? So, Bill Gates just did an AMA that's Ask Me Anything, where he went on Reddit and answered everybody's questions about the COVID virus that's going on right now. So, he thinks it could take 6 to 10 weeks before the United States has really prevented like the spread of the virus. Well, to be honest, I think it could be even longer, like 2 to 3 months. So Bill Gates has actually been in the news a little bit lately. So he just left the Microsoft board to focus more on his philanthropy, the Gates Foundation. Now, primarily, they're trying to wipe out malaria, but they're also focused on biotech, especially related to pandemics. So in 2015, Bill Gates actually did a TED Talk where he warned the world that we were going to have this kind of like pandemics, and what we needed to do to stop it is basically have a global response system where we can test people, reduce the spread, and really get like drugs for therapeutics and get vaccines out very quickly. Now, the world basically ignored him. So basically, world leadership was like, okay, that's not really a priority. And now we're paying the price right now today with the COVID virus. All right, now just to cover a couple of hot topics from this AMA. So, first of all, testing. Bill Gates says that the US is not prepared when it comes to testing. We really don't have our stuff together yet. What we really need is some kind of like online website where people can just go and register for testing and talk about like their case, their symptoms, and like they're at risk or not. We really can just prioritize the elderly or at risk people with compromised immune system this way, get them tested within 24 hours so they can get the care they need. South Korea had a really good example where Samsung actually built an app in the phone where you can just go and say if you're sick or not, and they can just do online tracking of everybody. This was very successful. US should do the same. Now, my opinion, it should be like Apple and Google, or somebody can develop an app that we can all have on our phone to do this. That would be really effective. But at least the US government needs a website where everybody can go and register for this. All right, now as for treatment, so the Gates Foundation actually has a therapeutics accelerator. They're researching all the different options in biotech to really treat this disease. So the biggest thing we can do is antiviral treatments. It could be 18 months before we actually come out with any vaccines. And actually, they're researching plasma transfusions, which could be helpful. So people who are healthy and have recovered from the virus, transferring the blood plasma to people who are sick. Now, Gates says we should use that for health workers and people who are in severe cases. Now, my opinion is that, yeah, this plasma seems like a really good option. Apparently, it worked really well in China. And one really important topic Gates talked about was education, because during this crisis, like a lot of people affected, especially low-income kids. So kids like can't go to school, right? So literally, what you can do to help out is research how to help donate or get kids who are in low income to get laptops, and also to make sure that they're studying online using like Khan Academy, Scholastic, and other online resources to just stay, like keep pace with their education during while they gotta be at home. All right, now as far as slowing down the spread of the virus, shutdown is the only thing that really works. So social distancing, quarantine, and just staying in your homes. Now, we were already like late to do this basically, but countries are doing this now. It's effective, like it works. It's the only thing that really works. And it could be a while. So it could be like 2 to 3 months, but at least like 6 to 10 weeks. And that's gonna prevent the spread. Now, the biggest concern here is actually like poorer countries where they don't have the organization to effectively go in their homes, and their hospitals are gonna get overloaded. So I don't know what we're really gonna do about this, but it's gonna be a big issue. Now, in my opinion, in 2008, we paid for irresponsible financial industry with the credit bubble and the collapse of the housing. Right now we're actually paying in 2020 for the world, like global nations, not preparing with some kind of global response system to prevent this type of pandemic. And so like we the citizens are really paying the cost for this. So we need to step things up, everyone. All right, and as far as the steps recommended by the Gates Foundation, like what is this global response system? Well, first off, it's going to be testing and diagnostics. Like we need to be able to roll out tests like nuts as soon as anything happens, first signs of any problem, right? And really get people tested and have the numbers on that. Okay, and then next it's actually treatment. So therapeutics, antivirals, we need to have like a rapid drug discovery system. Okay, and then of course the final thing is vaccines that we can roll out to make sure that we're protected against these viruses like as they pop up. And so this needs global coordination. There's already a CEPI project, CEPI. It needs more funding. And what we really need to do is like everyone needs to be part of the conversation. We got to talk about this. We need a global response, okay? And that's something we have to raise to our leadership, because otherwise we're just going to be stuck in the same situation in the future. Hey everyone, thanks for watching. All right, so now we're going to be posting videos every day about the latest tech news. So if you want to stay up to date, you better subscribe and you will receive those notifications.